The chakra armor release of emotions, or C.A.R.E, is a powerful technique for releasing psychosomatic blocks. In my practice, I have found many chronic problems to resolve after only one treatment because the underlying cause was emotional. In one case, a patient had a chronic third lumbar subluxation for several months following the collapse of a chair. For 3 months, I treated him with osseous adjustments. And each visit, he had the same vertebra out of alignment. Finally, I looked to armor in his psoas muscle as a possible cause. We discovered that there was emotional stress due to the accident. Using the C.A.R.E technique, I cleared out the armor in the psoas muscle and again adjusted the vertebra. Over the next 2 visits, the vertebrae held in place, and I discharged the patient. In another case, a patient came to me with a visibly enlarged thyroid gland, exhibiting both hypo and hyperthyroid symptoms. In fact, she was ready to resort to surgery or radiation treatment to decrease the size of the gland. I checked for armor and chakra imbalances and found both. After clearing them out, her symptoms improved. A month later, she returned to her medical doctor. The swelling was gone, and her blood tests were normal. He said she no longer needed surgery. She was very happy. The treatment consists of first testing to see whether the cause of the symptoms is physical or emotional. If it's physical, traditional adjustments are used. If it's emotional, we first uncover what the underlying cause is, and then we see if it's a chakra, armor, or polarity imbalance. These are then corrected, which in turn alleviates the symptoms. How does the technique work? As the name implies, the C.A.R.E technique deals with the release of emotions through chakras and armor. First, we'll take a look at what chakras are and what armor is, and how they relate to our physical and emotional body.
The term chakra comes from ancient India. Literally translated, it means wheel. Chakras are spinning wheels of energy having to do with emotions and endocrine glands. In locating the chakras on the body, we will define each region by its upper and lower aspects and identify them both on the front and back of the body. The first or lowest chakra is located between the inferior aspect of the pubic bone and the coccyx. It is also called the root chakra and has to do with security such as food, clothing, and shelter. It governs the spinal column. The root chakra is an anchor for the body on the physical plane, and it's a channel for the will to express itself. The emotional problem associated with the first chakra is fear and is associated with a low will to live. Symptoms of first chakra imbalances include hemorrhoids, rectal polyps, and subluxations of the coccyx. The test points for the first chakra are inferior to the pubic bone in front or on the coccyx in back. The second chakra has to do with sex, procreation, and creativity. It is bordered by the umbilicus and the pubic bone in the front. In the back, the upper aspect is at L2, L3, the lower at L4, L5, and S2. The organs related to the second chakra are the gonads. Second chakra imbalances have to do with the reproductive system or the bladder and may include cystitis, prostatitis, PMS, pelvic inflammatory disease, and infertility. The second chakra test point is just above the pubic bone in front or on L2 in back. The crown chakra. The interior aspect is the frontal border, and the posterior aspect is the occipital border of the parietal bones. The crown chakra has to do with spirituality. It is said that the seventh chakra does not come into full functioning until a high degree of inner development has been reached. The gland related to the seventh chakra is the pineal gland, which the ancient Greeks believed to be the seat of the soul. The pineal contains vestigial retinal tissue and is considered by modern physiologists to have the possible function of a third photoreceptor, the third eye. The crown chakra governs the upper brain and the right eye. Symptoms have to do with hypertension, brain disease, nervous disorders, and various other problems. The seventh chakra is also known as the throne of consciousness. It acts like a computer, relaying the truth from the higher self to the conscious mind. Someone with a fully developed crown chakra will exhibit an aura of light, and the individual evolves from the human kingdom to the spiritual kingdom. The test point for seventh chakra imbalance is at the frontal border of the parietal bones in front and at the occipital border of the parietal in back. The concept of armor was developed by Wilhelm Reich. Reich attended the University of Vienna in the early part of the 20th century. where he had the opportunity to associate with such giants as Sigmund Freud. One of his primary contributions to the field of psychology is his recognition that mental and emotional conflicts are in fact rooted in the body. All modern psychotherapies that work with the body can be traced back to him. Reich's concept of armor is that of a muscle spasm due to an unexpressed emotion. All emotional conflicts and blockages reside in the muscles of the body, forming what he called body armor. Body armor serves the function of encasing the body in a protective muscular shell. This keeps out not only painful, but also pleasurable stimuli. Armor impedes the flow of breath, life, and emotions throughout the body. Reich reasoned that if character armor, which contributes to unhappiness, actually resides in the body, one could relieve and dissolve the armor, and thereby the neurosis, by working directly with the body. Armor can occur in any organ, or on top of any vertebrae, or in any muscle. Anytime you experience an old emotion that has been suppressed for years, you have armor. You can suspect any area of tight muscles in the erector spinae where there's a muscle bundle. You can also suspect the organs and muscles of the diaphragm and the masseter and temporalis muscles of the TMJ. Physical manifestations of armor may also be apparent in close inspection of the individual body parts, as years of muscle tension form the body in different ways. The pelvis holds feelings of sexuality and excretion. It may be tucked under, causing a flattening of the lower back. This may correspond to frequent leg injuries, sexual dysfunction, bladder irritability, abdominal tension, hemorrhoids, low back pain, and tension headaches. A pelvis tipped downward may indicate a heightened sexual energy and focus, even to the point of obsession with sexual contact. It is often accompanied by overdeveloped legs, indicating a strong need for security. There may be eliminative disorders and may be associated with toilet training forced upon the child too early. A very wide pelvis is often accompanied by soft, pasty hips, buttocks, and thighs. This may indicate a great deal of deep warmth. There may be a struggle with passivity and an attempt to overcome their flabbiness with action. The muscles of the lower back may be tight or flexible. A compulsive person may exhibit tight muscles and lack of flexibility. An impulsive person will usually have lower back muscles that are relatively flexible. This is easily detected by asking a person to bend over toward the floor without locking or bending the knees. The diaphragm controls the flow of energy throughout the body. When this region is open and unblocked, energy flows freely and the body-mind experiences health and pleasure. Emotions flow through it naturally and spontaneously. When the diaphragm is tight or restricted, there is a limitation of feelings, breathing potential, and energy flow. Severe armoring may be correlated with a violent temper, nervous stomach disorders, peptic ulcer, gallbladder disease, liver conditions, and diabetes. The lungs are a frequent place for armor to occur. Shallow breathing may indicate nervousness and anxiety. To breathe is to feel, and conversely, to limit breathing is to limit feeling. The heart is frequently armored in cases of chronic over-self-protection. Armor guards against hurt and attack, but also locks away feelings of warmth and nourishment. The left shoulder will often be rotated slightly forward in a posture that suggests a guarding action. The muscles that surround the thoracic region of the spine hold anger. Tight, tense back muscles indicate a chronic state of tension. Relaxed back muscles show a trusting attitude, appreciative of others. Feelings are more balanced and the heart is more available. The neck holds the head. A head held forward reflects an individual who encounters the world first with his rational self, and then his feeling self. Held forward, it may indicate a driving, aggressive attitude. Hung down, a statement of partial defeat and emotional exhaustion. A head tilted to the right reflects feelings of arrogance and defiance. To the left, a cute and playful attitude. The head tilted back, with a shortening at the base of the skull, shows a holding back of energy. A long, graceful neck reveals long, proud attitudes. A stout bull neck shows a tight, aggressive approach to life's demands. The muscles of the throat control our expression. Tight throat muscles show fear of expression.